Hi, everyone. I'm Jody Schwan. Thanks for joining us for the latest in our series of videos updating the various facets and factors related to COVID-19 in our community. The one we're talking about today is a big one. We're talking about the continued impact on our health systems, both as far as what they're seeing in terms of COVID-19 patients, but now how they are beginning to transition back to, I won't say business as normal, but at least some of those more routine elements of medical care. And so I am excited to be joined today by Dave Flicek, President and CEO of Avera McKennan. Hi, Dave. Thanks so much for being with me.
Hi, Jody. Good to be here today.
You and I last talked, it all blurs together for me, okay? But I'm going to say it might have even been in late March, early April, whenever it was. We were talking about surge planning even then. And as we looked at the modeling, and of course, it's a moving target. It's changed a lot over the course of even the past 2 months. But time and again, we sort of came back to this time period in May, where we are at today, that second week in May, mid-May, going into late May, where our area health systems, Avera McKennan included, we're projecting that they might be seeing what we'll call the peak in hospital resource utilization. What are you seeing today? Take me inside the hospital. What are the conditions like today?
Yeah, thanks, Jody. Well, what a difference a month makes, I got to tell you. Hats off to the governor, the mayor, the health systems, the community at large. It really is important you continue to mitigate the risk of this disease. We are right now feeling good that we have flattened the curve. So you're right, a month ago, we were really concerned about what May was going to bring us. And so far, it's been very steady. We've had a steady level of COVID patients, so it hasn't spiked up, it hasn't gone down. It's just been a very steady level of COVID patients that's very manageable for us. But honestly, the mitigation of social distancing, wearing masks, cleaning, washing your hands has really paid off. And so I do think this is going to run its course over the summer, maybe into the fall. We've had some models where Southwest Minnesota might be September, October-ish. And so because we're a referral area for that area, we could see this flattening of the curve go all the way through October. So we are trying to get back to business, not as usual, but business as usual, making sure that we can take care of both COVID patients, but also there's just a lot of disease out there that has kind of stopped coming in to see us. And we want them to know that it's okay for them to come back into the hospital. So that's what we're working on now, both sides of the equation.
What kind of models or what kind of projections are you seeing now as Sioux Falls is beginning to ease up on some of these strategies? We're definitely seeing more people out and about, which is great on one hand. And I know so many businesses are eager to welcome those customers back, and they are putting in a lot of mitigation measures. But have you been able to factor that into your projections yet as far as what hospital needs might look like come July, maybe once we've now all been out and about and circulating a little more freely for a few weeks, or is that just too hard to determine right
now? No, that's a good point. We have been building that into the model. That's why we're going slow about how we're bringing back folks on campus. As you know, we moved a large number of folks over to the specialty hospital. And so we are going to keep some folks over there just to go through the summer. But you're right. We do think what's going to happen over the next 4 weeks as we've taken some of the restrictions off on mitigation. And so we're going to watch that closely. But we feel very comfortable with the hospitalization rates. The level of ventilator rates isn't what it was originally. We have a number of ICU beds. We still are keeping 80 ICU beds. Our normal ICU bed is 28. So we feel very comfortable that we can keep care of the community. But you're right, we want to see how these next 4 weeks go for the community. And then I think there's the broader outstate South Dakota might hit a little later than maybe Sioux Falls is what we've heard. So we just want to be prepared. We're really hunkering down probably for all summer and maybe into fall, managing in both sides of the equation of COVID and back to business.
Do you guys have any fear of that so-called second wave? I don't know if it's accurate to call it that or not, but there's been a lot of conversation out there more broadly that come fall, we might see a resurgence of this. What are you anticipating?
Yeah, we read the same thing. That's why we're being cautious through fall. We do believe there could be people could get lackadaisical, stop wearing masks, stop social distancing. And so, or a nursing home or a community could be a hot spot. So we just want to make sure that we're ready. So we will probably be like this through the fall, making sure that we can be in both taking care of COVID patients in a safe, effective manner for the community, but also just get back to business. There are a lot of, I think we have a number of procedures that are backed up that people want to get their procedures taken care of. So testing, we're continuing to make sure before you have your elective procedure that we test you, not only for your sake, but also for the staff. So there have been built-in processes here now to make sure that when you do come and you get a procedure or you get a diagnostic imaging, that you're safe and that things are being cleaned and everything is going to be okay for you while you're at the facility.
Is that the case for pretty much any patient? I mean, if I'm due for a colonoscopy or a mammogram, am I going to have a COVID-19 test first, or does that vary?
Nope, so it's a great question. It depends on your health risk still. We want to make sure that you're not in, if you're in the high risk category, you're going to get one. If it's a procedure that it could be a procedure that intubation is required, we're going to make sure that you get a test. So it's not on everyone. It's just a 55-year-old routine colonoscopy with no colon comorbidities. You'll probably just have the procedure. And we'll make sure that everyone's protected in the room and the patient. But if you have comorbidities, we're going to make sure that you're tested just to make sure you're okay and the staff are okay when they do the procedure. So it's both on procedure and the patient.
What is your take on the level of testing currently available? I'll stick it just to the Sioux Falls area, but not just as far as you're concerned at Avera McKennan, but maybe the broader community. I know a lot of businesses have said, boy, if I could just be regularly testing my workers, I'd feel a whole lot better about things. I mean, my sense is we're not at that point yet, but how would you describe the availability of testing?
Yeah, well, I think we're all like every business. I wish we could test every nursing home resident, every employee in the nursing home, all businesses. Unfortunately, the supplies just aren't there yet. I think come fall, we'll be able to do that and it'll be a lot better. There is still, in some respects, a 30% false negative. So you could get a test and you're asymptomatic and it doesn't pick it up. So it's not the end all. Testing is very important, but right now we got to preserve the test. So we're going to do it based on the need of the patient.
Okay, sure. What other changes are you making as far as beginning to bring patients back? Are there some patients that you want to see first, maybe that have been putting off certain procedures? Is there a continuum in terms of who should be contacting you, or will you be reaching out to them to begin rescheduling some of those things that might have been put on hold?
Yeah, we have a long list of patients that we're calling based on needs. And first and foremost, we're going to be moving the cancer center. We're going to be moving back into the cancer center in the next week. The rehab unit, if you remember a rehab unit, it's the brand new rehab unit. That's actually on a separate HVAC system. So it's very safe to move our cancer patients in. And should we need room for COVID patients, we'll have that room available up in the rehab space. So we thought, it's time to get back, get the cancer folks back. And in order to do surgery out at the specialty hospital, we needed to gear up the specialty hospital out there. But it is all about screening patients. It's about making sure that those that are on the waiting list that really need to be seen get in first. Make sure they're comfortable that they get in. And so every physician and surgeon has a backlog of patients that they're following up with. So they'd be getting a call from us. Unfortunately, too, we've had some patients who maybe might have lost their job in the community and their insurance might be up at the end of June. And so they're really trying to say, we'd really like to get our procedure during the month of June. So we've been surprised about how many folks really do want to come back and take care of their healthcare needs. And we want to meet that need. So we're going to be gearing up through the end of May, and we should be back and running all of June.
Well, I know your own staffing has just really been shifted around. A lot of people are finding themselves in different roles. Unfortunately, some people were finding themselves without a role. You guys had announced some furloughs a few weeks back. Where are you at in terms of looking at bringing some of those people back?
Yeah, so it's always unfortunate that you have to do that, but the furloughs were necessary for us to keep their benefits, to keep them. We need a good workforce coming back. We're going to be bringing them back slowly as the volume builds. The time to do that was when we were slow, so that's why we did that, kind of managing the curve. But we have a resilient and amazing staff. I rounded last week with Nurses Week, and I got to talk to my ICU nurses and the floor nurses, and they got it. They just have a great attitude. They go, we figured this out. We got the equipment. We feel good. It's just amazing inspiration, that staff, that when you walk around the hospital. So if they feel comfortable, our patients should feel comfortable is what we're saying. So right now we're going to slowly bring our teams back, but we just got to do it as the volume comes back together. The first move, obviously, will be bringing the specialty or the cancer center employees back. That'll be our first move. Surprisingly enough, I have to tell you, cancer care was, there was very little drop off in cancer care. Those patients were very loyal and they wanted to take their treatments. So that was one area of the business that kept going. So we really did need to have the specialty hospital up and running. And thank God we had that hospital. That really did make a difference for our surge planning.
The timing on that truly could not have been better.
Yep.
If this were a year ago, you and I have talked about that, but that would not have been an option.
Yep. I mean, that was just amazing, godlike, honestly. So I went out there, I drove out there today, I had a meeting, and it looked like a mini city. It was so busy. Then you come to this campus and half the parking lots are full. So it's just glad that we have that facility, and now everyone's looking back to get back to some normalcy. It's not going to be all normal, but we just want to get moving forward living with COVID. We're just going to have to figure that out as a disease, and how do we manage it, keep everyone safe.
Well, and that leads me into my next question, which is just, is there any message that you have for the community? Because this is it's been a huge adjustment. It is now, again, as we're trying to get back into some of our more normal activities. And I'm seeing a real lack of consensus, I'll just say, among people in terms of, maybe how intentionally they're taking some of these guidelines. I don't know that I see masks everywhere. I don't know that I see people spacing out, and it doesn't necessarily feel automatic either. Got to acknowledge that. But how critical is this from a medical perspective, that people do take some of these things seriously as they try to get back to some sense of so-called normal?
Yeah, your point of view is from the world, you see it. And all you have to do is go up to the ICU and see people in pampers and gowns and really taking care of a sick patient, that you really say, please wear your mask, wash your hands, social distance. As a healthcare provider in this community, we are going to lead that way. Our employees, when they're out and about, really need to wear their masks, show the way to the citizens of Sioux Falls and the community. Honestly, we want to just make sure we can take care of our friends and neighbors, and by flattening the curve, we can do that. And so if we don't continue to be resilient through the fall, I would just say through the fall, we just have to be smart about this. You can still go out and universal precautions, but I will be wearing a mask through fall, and I'm okay with that. It's the new look, and I'd encourage my staff to do the same. Wash your hands. I had a doctor say, hey, I'm not afraid. I'm going to shake my patient's hands, but I'm going to wash my hands. So, I mean, that's how people are becoming comfortable with it, as opposed to we're going to keep hiding from it. So I think that's the message, is stay diligent, mitigate the risk, but it's important so that we can take care of you long term.
I'm with you. Well, no surprise. If you know me, I've now got a mini wardrobe of masks. So, may as well wear them. Anything else, Dave, before I let you get back to work?
No, I think we're just excited that we can get back to some semblance of normalcy here. I think I was just meeting with some floor nurses, and they're saying, hey, look, we have some surgical patients on the floor. That's exciting again. So I think the staff is ready. We want to take care of the community. Just the community needs to know it'll be safe once they get here. You'll be screened when you get here. You'll get a little button. For a while, we're going to continue to monitor the visiting policy just for a little bit to see how this goes. And our staff has been just amazing. So you just can't, and it's been amazing nursing week, and now it's hospital week. So we have a lot of fun. We've had a DJ in the skywalk. They've been having a lot of fun. Heroes work here is what I would tell you.
Fantastic. All right. Well, thanks again for all your work and all that your team does, and for keeping us in the know and updating us all along the way. We'll, of course, continue to do that, but wish you all the best. Thanks so much. Again, Dave Flicek, President and CEO over at Avera McKennan. We've got some more videos coming up for you throughout the week, some fun things too. I didn't make a schedule because I didn't really know what to expect this week. That's sort of been the theme all the way along. But I think we've got a fun one tomorrow afternoon. So tune in live if you would like. And then Friday, Part 2, get ready to shop local, the 605 Made virtual market coming to live on Friday. So we'll look forward to that. You can view the detail as far as what Avera patients can expect as they do go back and get into some of that more routine medical care. They've got some great guidelines that we're going to be posting up on our website. You can watch a replay of this video too over at siouxfalls.business. As always, thanks for watching. Have a great day.